So when we talk about what causes myocarditis, the inflammation of our heart muscle, so myocarditis or pericarditis, inflammation of the outside lining of our heart, we can think about two main causes or etiologies. It can be either of an infectious cause, meaning a microorganism like a bacterium or a virus or a fungus or something like that. Or it could be non-infectious. Non-infectious, pretty intuitive, right? But from here, we'll make some other distinctions about what we mean when we say non-infections. That's not as obvious as what I'm putting here. So it's either infectious or non-infectious, and I'll talk about the main causes that fall under each of these categories. And we'll start up here with myocarditis. And in fact, the number one or the most common cause of myocarditis and I'll just write here the first world. So the most common cause in the first world or the developed worlds is a virus. It's a virus. And if you want to know the detail, this virus is specifically called the Coxsackie virus. Coxsackie, or sometimes it's called Coxsackie viridae. But the Coxsackie virus is the most common cause of myocarditis in first world countries. And for some reason, medical professionals like to make the distinction about the most common cause in South America, because it's an interesting sort of pathogen or interesting microorganism. Or so let's say, for instance, you just came back from watching a couple of soccer games in Brazil, maybe, and you've got this persistent chest pain, and we do a couple of tests and we realize that there's an abnormal rhythm in your heart. And so over time you find out that this person is infected with a protozoan, which is a different class of microorganism from a virus. And in fact, malaria is a type of protozoan, but it's not the one I'm talking about here. The specific protozoan that's involved with myocarditis from South America is known as Trypanosoma cruzi. And maybe you know it better by its disease name. This is Chagas disease. And Chagas disease does not only involve myocarditis, but you also get an infection of the esophagus and other parts of your body. So it's this constellation of signs that would lead physicians to start thinking that maybe it's Chagas disease instead of a typical viral myocarditis that we commonly see in the States. And then a final infectious cause of myocarditis I should mention here, I'll just write this is an important cause of myocarditis. And this is a type of bacterium. And the specific genus and species of this bacterium is called Borrelia, with two R's, Borrelia, and then this species name is a lot of fun to pronounce, Borrelia burgdorferi, which you may more readily recognize as the disease Lyme disease, especially if you're from Lyme, Connecticut, where it was first described. So Lyme disease is also something that can lead to myocarditis, but mind you, this is advanced Lyme disease. Early on, you'd get more of the skin signs that are classically associated with that and some arthritis, but myocarditis can eventually occur if you have what's called chronic Lyme disease. So let's skip on down here to our non-infectious causes. The first one I'd want to mention for myocarditis is idiopathic. And what does that mean exactly? Well, the way I remember it is that an idiopathic cause is one that makes us feel like idiots because we can't actually figure out what it is. So idiopathic means the cause of a disease that is unknown. So I'll write in parentheses here a question mark. So idiopathic myocarditis is myocarditis of an unknown origin. But because a virus is so overwhelmingly the likely cause of myocarditis, some physicians will just chalk up idiopathic myocarditis to just be likely viral in origin. So it's likely a viral myocarditis. In fact, some literature suggests that about 50% of all myocarditis is idiopathic, and that most likely just is viral. All right, so let's move on to our next cause right here, and this is a disorder. It's an immune system disorder that's called rheumatic fever. Rheumatic fever. And rheumatic fever is caused by a streptococcal infection. So, all right, a strep infection. So this could be something like strep throat, so strep infection, or it could also be what's called streptococcemia, which just means a blood infection of streptococcus throughout your bloodstream. So this strep infection will then end up causing the immune system, to make antibodies. And I'll abbreviate antibody as just AB, antibodies that end up attacking your myocardium. And so rheumatic fever is a big deal because if it's not caught, this could potentially then be a life-threatening disorder that attacks the heart muscle. And this actually is something that we are more concerned about in developing countries where we don't always treat a sore throat strep infection. In the States, if you have a sore throat that lasts long enough, people are more likely to go to the doctor and get an antibiotic for that. So other than that, there's also a couple of drugs or substances that you can take that are what's called cardiotoxic. And as the term suggests, that means that they're no good for the heart. And there are a bunch of things that are cardiotoxic, such as cocaine, which honestly is no good for any part of the body. If you abuse alcohol, if you take in too much alcohol in a short period of time or over years and years of consumption, that can be cardiotoxic. There's also carbon monoxide poisoning, which is something to be concerned about if you fall asleep in a garage with a car on. Carbon monoxide poisoning can lead to myocarditis. And then certain chemo drugs, so chemotherapy drugs that were used more commonly in the past can also cause myocarditis. And I'll give you an example of one of them. It's called doxorubicin. Doxorubicin is known to be associated with myocarditis in some people, but not all the time. So these are just some of the drugs or substances that you can take that can be myocardiotoxic if you want to be that specific. But then finally, there are also some systemic diseases. So, all right, systemic diseases that can target the myocardium to cause inflammation there. These include things like lupus, which is a disorder where you make a bunch of antibodies against parts of your body that should not be attacked by the immune system, but are, and so that can cause myocarditis. There's another disorder that's called sarcoidosis, where you have granulation tissue or inflammation tissue, it's another term for inflammation, granulation tissue setting down in the myocardium, causing inflammation there. And there's another disorder that's called systemic sclerosis or scleroderma. All right, scleroderma right here, which is when you have the connective tissue protein collagen being made in tissues that it shouldn't be made that commonly. So sometimes you'll see an excess amount of collagen be made in the skin, making your skin very tight. Sometimes it's made around the esophagus, making it difficult to swallow. And sure enough, scleroderma can also deposit a bunch of collagen in your myocardium to cause myocarditis as well. So let's shift over to pericarditis now. Let's start with infectious causes there. It used to be that the Coxsackie virus also was the most common cause of pericarditis, but recent studies have suggested that the number one cause of pericarditis, and this is again for the first world, so in developed countries, first world, may be from viruses. So all right, viruses. So viruses such as what's called cytomegalovirus. There's also herpes simplex virus, which is the herpes virus you hear about a lot. And there's also the human immunodeficiency virus, or HIV, which you may have heard of as well. In the third world, however, we make a distinction for pericarditis. There's a different most common cause out there in the third world countries. So the third world, pericarditis, especially if it's advanced, is from a type of bacterium that you may have heard of before. It's called Mycobacterium tuberculare, or TB. TB is the most common cause of pericarditis in the third world. And I'll write down here as a side note, this is especially true for constrictive pericarditis. And we'll talk more about what constrictive pericarditis means, but I think I've already touched on it. It's so much inflammation of the pericardium that the heart isn't able to fill with an adequate amount of blood to pump to the rest of your body. So TB is especially the cause of constrictive pericarditis. So let's skip on down here and let's talk about some non-infectious causes of inflammation of the pericardium. And I think one of the most interesting ones is what's referred to as a post-myocardial infarction pericarditis. Post-myocardial infarction pericarditis. And maybe I'm throwing a lot at you by saying that here, but just suffice it to say a myocardial infarction is the exact same thing as a heart attack. Heart attack. Myocardial, you might recognize as myocardium. An infarction means a loss of blood flow leading to tissue death. So a myocardial infarction, or it might be called an MI. You may have heard that term. But this is also referred to as Dressler's syndrome. Dressler's syndrome. And Dressler's syndrome happens between something like 2 to 3 weeks. So I'll write 2 to 3 weeks to 1 month. I'll take advantage of the terminology we just introduced earlier. 1 month post-MI or after a heart attack, where you have markers in the myocardium that are altered because of the ischemia or the loss of blood flow released into the bloodstream that cause the immune system to create antibodies to it. And these antibodies, for some reason, will also attack the pericardium as well, resulting in post-myocardial infarction pericarditis. All right, let's move on. Another important cause of pericarditis could be radiation exposure, and this isn't just one chest x-ray. This is having multiple CAT scans of your chest over and over again over decades could cause radiation-induced pericarditis. And the mechanism for this is what's called reactive fibrosis. Reactive fibrosis is what results in pericarditis here. Another important cause is cancer. Not cancer of the pericardium, but cancer elsewhere. Maybe you've got lung cancer or you've got breast cancer. And what happens is these cancers that are occurring elsewhere, they spread to seed. So seeding meaning they start invading or populating. So they seed the pericardial space. They seed the pericardial space and they cause reactive inflammatory changes because they're present there. Another important cause of pericarditis is just plain old trauma. Maybe you're in a motor vehicle collision and it's a deceleration collision where your car is stopped really abruptly because you've run into a wall and then you fly forward and your chest hits the steering wheel so hard that the steering wheel is deformed. So what that does then is you end up getting what's called a contusion. Contusion, which is just a fancy word for a bruise. So a contusion from compression of the sternum. So compression of the sternum, which is a bone in your chest, and I'll show you a picture of it in a second. So the sternum, which is also known as your breastbone, on the pericardium. So it's the sternum on the pericardium, and it compresses it and causes damage to the pericardium. And when the immune system tries to heal the pericardium, it ends up becoming inflamed temporarily, which causes pericarditis. So I've got this nice animation here, and this is so cool. This is an animated sagittal cardiac MRI. So MRI meaning this is a magnetic resonance image, and this is just a special way of taking a look at what's happening in the chest. Sagittal meaning we've cut this person in half, like if you karate chop them right through the head and down through the legs. What we're seeing here is the right side of the heart, and this is the right ventricle pumping blood through the pulmonary artery and out towards the lungs. And this part that ends abruptly, this is the aorta. This is the arch of the aorta that goes into the thoracic aorta, if you know those points of anatomy. If you don't, that's okay. But the aorta here is supposed to connect to the left ventricle, but we don't really see how it connects. It ends abruptly up here because we've karate chopped between the right and the left ventricle. And so that's why we're only seeing this here. And the heart, of course, is just beating away blood into the aorta very beautifully. The point of this image I want to show you here is this bone that sits here. This is the sternum. This is the sternum that's right here, and this is the top part. You have the sternal notch that's around here, and when you have a car accident and the steering wheel compresses against the sternum here, this will then be shifted backwards and it'll hit against the pericardium. It'll hit against the pericardium and then compress the heart. Then in fact, in CPR, or cardiopulmonary resuscitation, when you compress on the chest, you do chest compressions to artificially pump blood out of the heart into the aorta and up into your brain to oxygenate tissue while a person is not beating their own heart. You also do the same thing where you have the sternum press up against the pericardium. That's another cause, potentially, of pericarditis as well. So this is a great image that we can see all of this happening here as normally it should with the heart pumping, but realize the sternum sits right here and could compress against the heart in a traumatic way in an accident. So let's be gone with this image, go away, and let's keep talking right here. So the last sort of subgroup of causes I want to talk about that are non-infectious are metabolic causes of pericarditis. Metabolic causes. And there are two main ones I want to talk about here. One is called hypothyroidism. You may have heard about the thyroid. The thyroid is an organ that sits in your neck. Hypothyroidism is when this organ is not releasing much thyroid hormone. And thyroid hormone is responsible for increasing your metabolic rate, increasing blood pressure, and a lot of other things in your body. When you have hypothyroidism, you don't have enough of the thyroid hormone. So you can get arrhythmias. Your skin can become coarse because you have a slow metabolic rate. These people tend to gain weight as well. So hypothyroidism, for some reason, will also cause pericarditis that is best treated by replacing this missing thyroid hormone. Another important metabolic cause of pericarditis is what's called uremia. Uremia is just the buildup, so I'll write in parentheses here, buildup of nitrogenous waste. I'll just write N for nitrogenous. Nitrogenous waste. And it's the same type of waste your kidneys should be getting rid of. It's urea, if you've heard of that type of waste product. It's a nitrogenous waste product. But in folks that are on dialysis with end-stage renal disease or chronic kidney disease, their kidneys don't work. And so they rely on dialysis to get rid of these waste products. If they skip a dialysis session, then maybe these nitrogenous waste products can build up and irritate the pericardium, leading to what's called a uremic pericarditis, which is something that's treated with dialysis. You get rid of the nitrogenous waste, you get rid of the uremia, you get rid of the pericarditis. So in the next couple of videos, we're going to start talking about how we can treat or diagnose myocarditis and pericarditis. For infectious causes, unless it's a viral pericarditis, you'd probably use an antibiotic. For a bacterial or a fungal or a protozoan cause of your myocarditis or pericarditis. For a non-infectious cause, you would treat the cause. If it's something that you're missing, like thyroid hormone, you replace thyroid hormone. Some things you can't treat, you can't make trauma not happen, but it's important to understand what the cause of their disease was to help guide the way you would treat it.